So thank you, Michelle, and thank you everybody for being here today. This is an exciting panel. In terms of getting ready for this panel, I learned a ton, and it was a very sobering sort of exercise, but it's also very inspiring because we have some fantastic panelists who are really on the front lines of dealing with climate change and its impacts on health, both locally and in the local health system. And so first, I'd like to start by having you all introduce yourselves and just give us a few minutes about your background, what you're doing. We'll start with Megan Wise, please.
Hi, everyone. Thank you so much. Lovely to be here. My name is Megan Wise. I use she, her pronouns. And I'm the coordinator at the Climate Hub at UBC. I'm going to introduce myself in the way that I've learned in the communities that I work with. And I am a settler descendant of Danish and Ukrainian farmers who moved their way into the Okanagan Valley. And so I grew up in the Okanagan Valley, and that is where my heart lives. Those are the landscapes that are deeply imprinted on my being and how I think about connections to land and nature. And that community, my community, has been through profound climate change impacts. Recently we had devastating wildfires. I've had family and friends that have lost homes. And so thinking about those relationships to land and the work that I do, in the climate work that I do, I feel a deep sense of commitment to the health and well-being of community in relationship to the impacts of climate change. And so my background, I'm a poli-sci background, sociology background. I did my undergraduate honors degree in researching ideological denial of climate change. And I spent my master's thesis working on exploring how we understand climate change as a fossil-fueled pandemic. So as I was writing my master's, COVID unfurled upon the world, and looking at the lessons we can learn from that. And so in the work that I do, I work a lot with youth and students, and we work on programming that works with community on climate storytelling, climate justice research opportunities for students in partnership with community who are looking to deepen and kind of broaden their ability to engage in climate justice principles through the work that they do. And we work with students to bring climate content into courses at UBC through a unique program called the Climate Teaching Connector. And then another thing very relevant to this conversation is when I was a student staff there before stepping into coordinator, I started the Climate Wellbeing Engagement Network. And what that does is focus on building resources and workshops to support community in navigating the mental health and well-being impacts of climate change. And so we have public-facing resources to meet community where community's at, and run workshops with youth and community members to explore how to navigate and support each other in the different strategies we need to address the health and well-being impacts of climate change.
Great, thank you. Oona.
Wow, how am I going to follow? So well done. Ahauza. My name is Oona Krieg, and I am also an uninvited guest on the lands of the Stolo, Tsleil-Waututh, and Musqueam First Nations. And as such, standing up for that Light Step legacy is something that I think about every day. Walking gently on this land, not appropriating the space, not thinking about this home as my own, but as one that was built on the bones of other peoples. So my history, what I'm doing here, why am I here? The existential question. So I've been working in risk reduction, harm reduction, violence reduction, Indigenous women's rights, the status of women, increasing the status of women and health outcomes for the past 20 years, mostly in the downtown east side, working with innovations in medical care, culture as medicine, innovations in housing approaches as far as like low and no barrier housing, systems change thinking as far as how to increase the mobility, accessibility, and health outcomes for folks who are suffering underneath a system that was built to disclude them from what's considered the general population. I worked across British Columbia as a peer navigator. I created a bunch of peer-to-peer program, like Nothing About Us Without Us, peer programming to increase the esteem of people in community who identify in a peer group so that they are able to have a voice at the table trying to solve the problems that are facing them instead of being told how to solve and being a token person in these spaces. So systems change. When I met Gordon, the co-founder of Brave Technology Cooperative, I was deep in the overdose crisis. At the time, it was just a crisis. It was not considered an epidemic. And I was exhausted by the 200 times that I had reversed overdoses in alleys and nearby places, in stairwells, in bathrooms. It just seemed like people were dropping like flies. Walks in Gordon Casey, who says, how is this community surviving? And it's the community, given resources to protect itself, are able to, because it's a visible community, they're able to get naloxone to the site. They know the when and the where of an overdose, and they're able to get naloxone to the site and start applying rescue breaths and applying a community-based mutual aid version of overdose reversal. He's like, do you think that technology could scale that? and I looked up from the downtown east side, and I looked at Vancouver, and then I looked at BC, and then I looked across Canada, and then I looked to the United States, and then I started looking at the UK, and then I started understanding at a global level, and I thought, oh my God, technology might be the only way that we can scale this solution into, like, at a global level to have population level impact. And I got very excited, and we got to work at beginning Brave Tech Cooperative, and we began to develop tools, relationships, coalitions, and really started to, I'll borrow from Adrienne Brown's work, is seed the preconditions necessary to hold change. And I got very excited. So that's why I'm here. And I hope I haven't gone on too terribly long.
No, Michael, tough acts to follow.
Absolutely, and it's a real pleasure. We've just met in person recently after working together to plan for this session. And I'm Michael Schwandt. I work in public health. I'm a medical health officer at Vancouver Coastal Health. And climate change has been described as the greatest public health challenge of the 21st century. This was said by experts, global experts, before the COVID-19 pandemic. It was true then. It's still true. This is a crisis that, whether through extreme heat, through wildfire smoke, through drought, storms, and displacement, is expected to have more impact on human health than any other single issue. So as a public health professional, this is a natural to come to this, and it's working in a field that concerns itself with prevention, taking the whole community or the whole population as the patient, and looking at complex solutions to complex problems. This is an exciting space to be in with colleagues like this. We know that there's an intersection of crises that lead to the impacts of public health. When we think of the BC heat dome, we know that this was a collision of underhousing, a lack of social connection, and of course the climate crisis. So when we think of the complexity of any one of those issues, we see how many different issues we need to approach all together, and that takes an all-of-society approach. So while the impacts might be on the health sector, it's really multiple different groups that need to get together on this. So without saying too much more about my own background, I'll just introduces the, I guess, the public health interest in this topic, and really looking forward to the talk today.
Well, thank you. So I'd like to start with I think we mentioned, many of you have mentioned, is the heat dome So when I was doing some research for this, I found that the coroner's report suggested that like 680 people died due to the heat dome. That was very troubling, sobering, and it really sort of stressed the impact on folks, different types of folks. So I'd love to hear your perspectives for your communities and how it's directly impacted the people that you work with and support. I'll start with Oona.
I mean, of course, every crisis has a disproportionate push, oppressive force on folks who are already displaced. So folks who live under especially folks who live under the guise of the shivering denizens of the downtown east side, as an example. But you're more likely, we have a predisposition to suffer from heat exhaustion if we have any kind of medical issues that go on. So it's not just my people who were my people. It's not just my people who were impacted. That was more impact on our folks. I'm so sorry, I'm like stumbling here. And just shake it off. The heat dome brought up something else for me, more than it was about the health impacts on people who we serve with Brave Technology at large, and who I've been working with in community for a long time. The heat dome brought up the fact that the system, that the call and response of emergency had been gutted to the point where a community was no longer able to respond to itself, didn't have the resources to respond to itself. And as a result, folks who were already on the threshold of, with mental health or medical health issues, were more likely to experience the isolation that would drive fatality, as opposed to the being able to circle up and have folks in community come by and help with applying cold water around people's necks, or giving CPR when one person couldn't give CPR anymore. And it really frustrated me, because it's like, at the time I was on Tinder, yes, please don't judge me. At the time I was on Tinder, it's like I could fly in anywhere. I could get a date within like 2 seconds. Anyone can get a date on Tinder in 2 seconds. Like, it's not, I'm not saying that. What I am saying is that, so why was this woman in Abbotsford who manages a housing organization waiting for 3.5 hours for emergency services to call up, while she gave up after 20 minutes of applying CPR to one of her residents who had exposure, heat exposure? Within a stone's throw, there was another community member who, if they knew and had the resources, would absolutely have been there in that time. So we become so reliant on these systems of call and response that were gutted 15, 20 years ago, that have disabled our ability to have a community response. So for me, that was more the piece that was coming up than just how it impacts people who use drugs, or people who have mental health issues, or people who live below the income line, or those who are housing challenged or housing, scarce, depending on how you want to say that. It really showed that the impact across the board is that we've lost the means to be able to respond to our own emergencies.
Wow, excellent. So, Michael, along those same lines, in our pre-meeting, you discussed sort of the impact of smoke and heat on farmers versus people in the downtown east side, and how there's more similarities than differences. Could you kind of expand upon that and how you deal with that in your personal in your work?
Well, sure, John. I mean, this came up in a discussion about some of the inequities that we see in these impacts, talking about our colleagues over in Fraser Health and in Vancouver Coastal Health. And this was said as well during the COVID-19 pandemic, that this is, you know, a storm that we're all in together. And many people wisely observed that we might be in the same storm, but not in the same boat, in that these impacts are going to touch us in different ways, whether that's climate-related anxiety, direct impacts of extreme heat, perhaps sensitivities to wildfire smoke. There's going to be inequities and differences in those impacts. Many of those, it has to be said, are unfair and preventable. So when we talk about some of these impacts of extreme heat, we know that people who are housed in some neighborhoods of our city were 2 to 3 times more likely to need to go to an emergency room, more likely to pass away, to die during the heat dome than people in other areas of the city. And this was around fairly predictable lines, around material deprivation versus wealth, around access to cool and green space versus not, access to air-conditioned and safe housing versus not. So this is one major difference that we see. And then meanwhile, we see exposures to wildfire smoke that are higher among people living outdoors, people working outdoors. This is how the discussion around people working in agriculture came up, including people who are unable to take shelter, who are working in precarious situations. And this can be said for many of these different crises right now. And it applies not just at an individual level to individual risks, but at a neighborhood or community level in some cases. When we think about drought, which many communities have been experiencing in British Columbia through the summer due to these longer and drier summers, hotter summers that we expect to see, we know that many water systems in rural communities, and in particular in First Nations communities that have been left vulnerable by under-resourcing for decades, this is due to colonialism and due to systemic racism, are more vulnerable still to the impacts of drought right now. So we see very uneven distribution, but we can recognize that and we can manage that through work, not just as a public health system, but by society at large. So thanks for that question.
Yeah, thank you. So along those lines, Megan, I'd like to get your perspective. So, you know, the work that you are all doing is impacted by misinformation. Is this something that you mentioned and in your background looks like something that you fight on a daily basis? So could you help us, and could you also make my friends down in the South understand a bit more the challenges of misinformation?
Yeah, oh, thank you for that. And thank you for both of your reflections there. The work that I do is, I work a lot with students and youth and community members, community partners. And we were kind of having a conversation actually in the room together before coming out here and talking about the impacts of climate change on communities and looking at the root causes of that. I'm glad you spoke to colonialism and racism. There's these bigger systems at play in our world that sometimes we assume are innate. They just exist somehow naturally in the world, yet these are very constructed systems that we live with and amid. And how are these systems informing our experiences and relationship to climate change? The things that are causing climate change, the things driving climate change, the impacts we feel on an individual, community, or systems level. And so thinking about this layer of misinformation or disinformation, this is the landscape we currently live in. And I'm not sure, you know, if I could take a poll of hands up in the room, who has had to deal with somebody who has been captured by disinformation? And thinking about how are we, yeah, I can put my hand up here, I work in climate change, yeah. One of the things that we've had lots of conversations about with students and things like that, first of all, in the climate wellbeing engagement work that we do, we build a lot of resources for community. How are we telling the stories of impact, making sure that we understand each other's humanity and the shared dignity that we need to have as people experiencing inequitably for many different reasons, thinking about sociodeterminants of health, things like that. What are the pathways that we can connect to community that help to cut through disinformation? Because disinformation can really act as something that reinforces our worldviews. Climate change is challenging our worldviews in many ways. It's challenging how we have to think about economy. It's challenging how we have to think about systems of energy. It's challenging how we have to rethink transportation. And so when we are confronted with that, it can be very unsettling. It can be very unnerving. We assumed the world works this way, and so now I have to take time to reflect on how I ideologically or make up my understanding of the world. That's hard. It's fear-based. It's reactionary. That's our instinct as human beings. And so how do we pull back from that and ground ourselves in community connection based on things like shared values? So where are the bridges that we can identify and reach out to and see each other's shared humanity, each other's deserving dignity, and how can we build together with that? Because we don't have a lot of time to go down the path of mass polarization. There's mass harm down that road. And so in everybody's work, I'm sure this entire room comes from such a rich background of engagement and knowledge and networks and pathways and communities. What is it in your work that you can identify and reach out to community, thinking about the impacts of climate change in relationship to building solidarity, building shared dignity, building bridges and pathways grounded in shared values? It's hard work. There's no silver bullet or one kind of pathway through that, but it's something to reflect on and think about how we come back together as opposed to how we keep merging apart from each other in polarization amid mis and disinformation and malinformation, which is weaponized information as well.
Great. And so one of the things that we were talking about before this panel was sort of the shared values, and it was something that sort of, when you think about the climate change, it's certainly increasing in terms of engagement, et cetera, but in terms of the, the drug poisoning crisis, how does shared values really sort of, how does that impact your work at Brave and your work with, folks who are displaced, et cetera?
I think that a lot of our work around creating, so I was a staunch harm reductionist. I really believe in meeting people where they're at. And that includes people who have opposing behaviors and views to mine. I can't graft a new idea. I can't bring someone into a stage of change that they're not ready for without having found whatever that common ground is. Usually the common ground is grief. People build up these walls around grief. The other common ground that you're talking about, this shared values piece, is like literally how the economic forces have continued to drive climate changes because they have shared values, of which the climate is not one of them. So in working on trying to, I can't change anyone's opinion. I can't appeal to a sense of heart if they don't have compassion, right, for the, to create that connection. What I can do is find out what is it that they're grieving in order to lean into what we were talking about earlier, is like that tender state of transformation that needs to happen in order for the mind and the heart to open up to plant some other ideas in it. And the World Health Organization in 2018 wrote this beautiful, the status of the opioid epidemic, and it is titled, "We don't have a drug problem, we have a drug perception problem." And it's like, so a lot of our policies are driven by a perception problem, stereotyping, digging in at those shared values with people. It's like you've got shared political aims, you have shared political values, you have a shared type of economy that brings in a very particular brand of return on investment. Those are like, staunch and really, really difficult to change. So it has to start at this grassroots level. So then how do we train enough people in the harm reduction approach to begin to have all of those conversations with their family members? We have all been there. You have all sat at the dinner, the family dinner, and they're like, someone in your family is like, oh God, I hope she doesn't bring that up, because it's just going to be a big fight, because people are really set in their ways, especially if it has been forged by grief. And most of the time we're making decisions to take a polar you know, it's either all good or all bad, it's either all black or all white, because we can't live in the gray because we're living in the grief body. There's a lot of grief associated with dealing with and looking at climate change. There's a lot of grief associated when dealing and looking at the number of people that we're losing due to overdose. There's a lot of grief when we're looking at pollution level events, when we're looking at, you know, people who are not able to survive cancer or access treatments. Like, there's so much grief, so there's a lot of mistrust of the solutions that are in place. So there you go. There's my 2 bits.
Great, thank you. And so, you know, one of the terms that you used during our call was syndemic. And so, and there's the talk about the syndemic, all the things that are hitting us at once, and then the resilience of us and the healthcare system. So I'm going to read a quote that I found that really spoke to me. This is from Dr. Sue-Ann Bell from Michigan School of Nursing. We should think of resilient systems as a continuum of how we mitigate, prepare for, respond to, and recover from climate disasters. I'd like to start with Michael in terms of VGH and the province. What are we doing currently? What's working in terms of improving the healthcare system to make it more resilient?
Yeah, I really appreciate the question. I mean, we work in public health, trying to take that preventive approach that I described earlier, but also very closely with the systems that are downstream of that, looking at acute care, including the ambulance system, the emergency rooms in our hospitals as well, and all of those are part of a continuum. So I think that we'll see, and we do see right now in the health system, much more preparedness for emergency events like wildfires, like extreme heat that might affect our communities directly, or lead to people being evacuated to and from our communities as well. This is something, unfortunately, we've seen increasingly in our province right now. Candidly, most people who work in the health system will probably agree if their department, hospital, or clinic had a climate preparedness plan 10 years ago, if they had it, it was probably in a binder on a shelf, if not saved away in an equally dusty hard drive. This was not work that's been really normalized and socialized in the health system until very recently. Right now, our health system has required that every department, from the emergency room to home care and others, does need to have these preparedness plans in place for these sorts of things. And I think that sometimes when we look at the immediate reporting of events, tragic events like the heat dome, and we see ambulance systems overwhelmed or emergency rooms that are full, there's a lot of importance on addressing those things and ensuring we have the emergency capacity to understand as well, but also to look back to what are the community drivers of these issues. So what can we be doing in terms of social connection that we can actually support, in terms of safer housing that we need to be developing, and that continuum from what you could call acute care medicine to public health to even things that I think that are broader and even upstream of what we typically call public health services. But some of these actions that we've been talking about these shared values and approaches we can take really all do link together. And I think that when we think of things that way, we see more and more healthcare providers getting involved with this, developing approaches to planetary health, even in our healthcare system, which is actually a very big emitter of greenhouse gases, carbon emissions. So we have a lot to do within our own health as a healthcare system as well as trying to encourage that in the rest of society.
Yeah, we've had separate panels on that actually in terms of the sort of greening of the hospitals, et cetera, and sort of the opportunities there. And Megan, you've looked at, sort of the intersection of different communities, et cetera, on healthcare and climate change. How do you see resilience coming into the system?
Yeah, I appreciate that question as well. Resilience is this word that we hear a lot. And I'm going to do a quick audience poll. Raise your hand if you've heard the word resilience used in relationship to climate change. Raise it high so I can see it. Okay. Now raise your hand if you feel like you can explain the concept of resilience to your neighbor. I see one hand. 2 hands. I see one in like one of these. And the reason I ask that is because we hear this concept of resilience a lot. And one of the things I'm really conscious of is how resilience, this concept of resilience, has really been weaponized in communities, specifically the communities that are most impacted by climate change, pandemic, opioid crisis, things like that. So taking a second to we've been working with students, and some of the work that's come out of the Climate Hub with a lot of student work and engagement is this idea of how do we reframe our understanding of resilience. So thinking about resilience is both a noun, something that we can get to, but it's a verb. It's fundamentally a verb. Resilience is never over. We don't actually get to it and go, oh, we did it, check, we're there, good for us. Resilience is something that we have to practice in so many different ways as community. We have to have it embedded in our systems. We have to have it embedded in our mindsets. We have to have it embedded in how we relate to each other. And so thinking about resilience in a way that is supportive of understanding the interconnectedness of crises, understanding the interconnectedness of vulnerability. What does that mean? How does that intersect in somebody's experience of pandemic, climate change, and opioid crisis, and housing crisis, and inflation? Where are the intersections of that, and how are you resilient? Not as an individual, but in relationship to the systems we put in place that allow for the capacity to thrive. And so my instinct there is to really, as a community, as a society, reflect on what are we asking for in relationship to resilience? What do we want that to look like? How do we need that to function? And so that's, I think, some of the work. And there's beautiful student work happening in and around these issues. And a lot of community conversations that can be fostered. So again, a call into community is if you use that word in your practice or in your network or in your organization or the work that you do, how are you using it? What does it mean? And maybe taking time to think on that and think about how it relates to issues of climate change.
Excellent, thank you. Are we up for Slido yet?
We have a number of questions actually on Slido.
I thought that we would. I'm not going to go to the second one yet. Michael, how are you partnering with different city governments within and outside Canada to share and learn about best practices to improve outcomes?
Wow, thanks for that question. And certainly within Vancouver Coastal Health, we have several different municipalities. Of course, the city of Vancouver, where we are right now, and that many different programs, whether that's emergency management, parks and recreation, who have many of the facilities to become cool and cleaner air spaces, city planning, trying to shape communities that actually support that resilience, not just ask it of people, but actually create the conditions for it. So we work with many different programs within municipal governments in Vancouver and other communities as well. We're often told by communities in respect that we can't just take the Vancouver approach and take that to Gibsons or to Powell River, much less to some of the other diverse communities around the region too. So it takes relationships and connections over the course of time, but we do try to work again with other parts of government. In terms of connections with others, we've had some really positive partnerships with, in fact, with Seattle and with Portland. There's a collaborative work that's happening that's coordinated by the University of Washington down in Seattle, trying to learn from our experiences, noting that we have very different experiences between those states, and they've told us, certainly between Canada and Washington. We've noted, they've pointed out, well, you have a universal healthcare system and you still had a lot of problems, and we say, well, the healthcare system isn't the only thing that's impinging on people's health in these cases. So we have a lot to learn from one another, and so that's something that we've been really happy to participate in and try to learn across borders, truly.
Great, thanks. I love this question. 20 years ago, social media viewed as a democratization of media. Now we see the emergence of polarized echo chambers. I think that's a nice way to say it. How do we get back to rational dialogue? Who would like to, I'm looking at Oona first.
I don't know. We need other media other than social media, other ways of connecting. I honestly, I thought that question is one of the most amazing questions of all time, and I will be pondering that at about 3 a.m. this morning.
Right. Megan, any thoughts on that one?
I agree we need more platforms of engagement. Like, again, we channel all of this through some really primary sites, right? And so when we think about social media. There's a few that come to mind. How are we creating space for dialogue in, I'll use even just, you know, an office example. So in my work, there was an opportunity to come together, and we'd never done this before, and there was a lot of wildfire activity, and we came together as a staff to just check in and say, how are we doing? We are bearing witness to mass trauma. And this goes back to your moment of grief here. We're bearing witness to mass trauma. And where's the opportunity to check in with each other just to talk about the feelings that we have connected to the crises we are bearing witness to? And making space for that, because I think that humanizes everybody. And so when we then go to look to social media, again, this goes to people's fear. This goes to people's sense of uncertainty, and it's easier to jump into an echo chamber and reconfirm those fears and uncertainties than it is to be vulnerable and open yourself up to your raw humanity with your fellow beings. So I think start small. Addressing social media as we need new social media platforms, sure, I think we do. And maybe you know, some policies around care around social media and things like that. But start small. Start with your network, your community, your office, and how you are starting conversations about your own shared humanity, and hopefully that has a ripple effect.
I just want to tack on to that I think social media might have been viewed as a democratization of media, but that's not actually what it was. So it's not, you know, it seems like this was the trajectory it was always going to go on. It was going to get popularized with the idea that it was a democratic, and then everybody was going to adopt it, and then people were going to start controlling the narrative and making sure that we were in those annals of information so that they could control the information. So that's just off the top of my head. So how do we get back to a rational dialogue also brings me to the question of, have we ever had one?
Excellent. So I think I'll combine two questions for the last few minutes that we have together for this session. So, you know, basically, what is your call to action, and really where to start? And I'll start with Michael. Give you the easy question.
Yeah, no problem at all. You know, it's I mean, of course, as you phrased it, Jonathan, it is a challenging question. One thing that I really hope that folks can do is to see some of the co-benefits in taking action for climate mitigation and adaptation. I think when we're looking at different community members, different audiences, some of the interventions that we describe from a health perspective, I would say, are almost magical cures at the community level. When we're talking about sustainable transportation systems that include active transportation, cycling, walking, public transit, these things have so many different benefits. Green spaces, not just for climate change mitigation, so trying to decrease some of our greenhouse gas emissions over time, which is a very important piece, but also for being more resilient, better adapted to some of the changes that we're seeing, to creating opportunities for physical activity and social connection. And I think that many times, even as public health communicators, we often focus on health as the sole goal. What can we do in terms of health outcomes this week, month, or year? But I think trying to understand from community members what are the impacts that other people are looking for, and to be in better contact with community will help us to do a much better job in communicating, sometimes getting over misinformation and finding shared goals, because some of these interventions have many benefits that aren't just for health or aren't just for climate change, but for a lot of different benefits.
Thank you. Moving to Oona, how can we support you in your mission with Brave?
Where's that question?
That's my own question.
That is a
Call to
great
action. So the reason why I ask, so I think we all sort of get climate change, we get the heat dome, but not everybody here has been impacted by the opioid crisis. So I'm asking, you know, what can we do as a community here that are sort of less involved directly? How can we help on that front? What's your wish?
That is a great question, but I think that with last year there being over 112,000 overdose fatalities in North America, I think we'd be far-reached to find any room that hasn't impacted at least one person. So I don't think that there are really a lot of degrees of separation at this point. The Gore stats are like since 1999, over 1 million people have died due to overdose fatality, which is largely reversible. Largely reversible, right? It's a lot. So for the general public and people who want to do good by doing this work, or are interested in reducing fatality and leaning into systems change thinking and population level change, how you can help me with my vision toward that is you can check out the website, you can volunteer your time with us, you can volunteer your expertise with us, you can listen to my wild ideas, you can become part of or involved in our process, in our gathering of collaborators, where we're trying to create a decentralized coalition for motivating an entire ecosystem change. You can educate yourself on absolutely every aspect, but at the end of the day, the thing that you could do the most is carry naloxone. Understand the signs of an overdose. Know that it could be happening on the bus, in a washroom, on an airplane, and be able to respond to it in kind. And that is the, turning yourself from a bystander into an ally in this work. So at the very minimal level, if you're interested or you've been impacted or you want to help, just carry naloxone, right? And then also, don't be a jerk.
Well, that'll be harder for some of us. Megan, how do we follow that?
Thank you for the work that you do. And thank you for that call to action, because it's an important one. And in thinking about how the community here can support some of the work that I do, and I see myself as working in service of youth and students in many ways in the role that I'm currently in. And so I bring that frame to this. When I'm in workshops, I do a lot of workshops with youth and students, and I do a lot of climate, health, and well-being workshops with adults and community members. When I'm in workshops with adults and I ask the question, what inspires you about climate work? What gives you inspiration? And almost always one of the #1 answers is youth. Youth organizers, youth voice, youth mobilization, grassroots movements, and calls to action coming from youth. When I do these workshops with youth and I ask that question, they never say adults. Not once have I heard youth say, adults are inspiring me on climate action. Usually what I hear from youth is that they're terrified, that they feel angry, they feel betrayed. They feel that trust has been broken and that the onus and the burden of action is being placed on youth. The expectation is that youth can do this. And the reality is we need to do this. So when I think about what are those calls to action, again, to use your framing of moving from bystander to ally, nobody has the luxury of being a bystander in climate change. Everyone needs to be an ally because climate change is globally collective work. And so how do you situate yourself to be an ally of those on the frontline communities, indigenous communities, groups who have been fighting environmental racism, who have laid the groundwork for this understanding of climate justice. How are we working in allyship to address these really complex, as you started off, climate change being the most important public health challenge we face collectively, globally? So that call to action is hear youth, support youth, get behind youth, lift up their movements, lift up their organizing, lift up their voice, and really create space and opportunity for them to co-lead a lot of the climate work that we need to do, because this is the world they inherit. And we want to make sure that it is a just one, that it is a fair one, that it is a thriving one, and that will take all of us.
Wow, thank you so much. So I guess we are out of time.
Oh, I'm sorry. I'm sorry to interrupt like this. I know where mine's starting. Somebody had a question on the hair. It all seems so much. Where can I start specifically today? Yeah. I don't want to leave you sitting in the audience with that question. Wherever you are, recognize that today, that question is because you care. And that care is enough for today. You care, and that's enough. Give yourself the grace and the empathy and the self-compassion to know that you care enough to ask that question, and that's enough for today. For other strategies, you can actually go to the Climate Hub website, and we do have resources that talk about systems actions, community actions, and individual actions. I recognize you're overwhelmed. I see you. I want to bear witness to that question, so sorry to go over time there.
Nope, all good.
Well said. Thank you very much. It's very impactful.